All right. So you sent over this medical review article on sepsis management.
Yeah.
And, it's a pretty dense one. But we're going to try to break it down for everyone today, especially focusing on the latest treatment guidelines for adults in the ER.
Right.
Because we know, sepsis, it's not something to mess around with. It can go
Yeah.
south really fast. So we really want to focus on what's new, what's surprising. Like, how are we fighting this thing effectively in the trenches?
And it's really relevant, too, because, people might think of sepsis as something rare, but it's a global health problem. With the aging population, antibiotic resistance is becoming a huge problem, and the condition itself is so complex. So emergency medicine is always trying to refine its approach.
Right, and that's where this review is so helpful. One of the things they jump right into is antimicrobials and
Yep.
like how every hour of delay increases the risk of mortality, especially with septic shock.
Oh, yeah.
Like that's scary stuff.
Yeah, it's true. It's really that kind of act first, confirm later reality in emergency medicine, right? When
Mhm.
minutes count, you don't have time to wait for every test to come back.
You gotta go.
You have to act.
Yeah. Which is why they're so big on the broad spectrum antibiotics initially.
Right.
But it is interesting because the article mentions that shorter antibiotic courses are now preferred, and they're using something called procalcitonin to guide that. What is that all about?
So procalcitonin, you can kind of think of it like a smoke signal in your blood. If it's elevated, there's a good chance that there's a significant bacterial infection going on. And so what's really interesting is they're using that to guide how long people need to be on the antibiotics, as
Yeah.
opposed to just putting everyone on a standard course.
I see. So they're using it to personalize the treatment duration a little bit more.
Exactly.
So they can knock out the infection without going overboard, avoid the resistance, avoid all the side effects, all
have
that.
a complication. Right.
Exactly. Now, the review also goes into fluid management, which is, always changing. I remember when it was like, flood them with fluids.
Right, right.
But this article suggests that's not really the case anymore.
It's definitely not a more is always better situation.
Right.
We learned that while fluids are critical, you can definitely overload people.
You can cause harm.
Yes. So the focus has shifted to what we call individualized resuscitation. And it's really about figuring out how much fluid each patient needs and how well they can handle that fluid.
And they use those terms, fluid tolerance and fluid responsiveness. Can you kind of unpack those a little bit for us?
Sure. So you can think of fluid tolerance as the body's ability to handle those extra fluids without, you know, springing a leak, so to speak.
Okay.
And then fluid responsiveness is really looking at how well a patient's blood pressure and their circulation improve when you give them the fluids. So it's not just about how much you give, but how much actually helps.
It's like finding the right setting on the dimmer switch, not just cranking it all the way up.
Yep.
Now, they also mention that there's been this shift from focusing just on blood pressure to prioritizing something called microcirculation. So what exactly is microcirculation and why is that so important?
Yeah. So microcirculation, think of it as making sure that oxygen is getting to where it needs to be at the microscopic level.
Yeah.
So you think about those tiny capillaries. Those are like the microcirculation highways. And even if someone's blood pressure looks okay, like on paper, their microcirculation could be a complete traffic jam.
Oh, wow.
And that's preventing oxygen from getting to the tissues.
So even though their vital signs look stable, they could be in deep trouble at the cellular level.
Exactly.
And that brings us to vasoactive agents, which are those medications used to increase blood pressure when fluids just aren't cutting it.
Exactly. It's like the backup generator when the power goes out.
Right, right. And this article seems to really like norepinephrine for septic shock. Is there anything about that stands out to you?
Well, what's interesting about norepinephrine is not only is it effective at raising blood pressure, but it may actually help to reduce the amount of fluid you need overall.
Oh, wow.
And we know that's a good thing.
Right, because of the fluid overload issue.
Exactly. So it's like a
Right.
2-for-1.
I like that, 2-for-1. Now, there's also mention of this debate around early vasopressor use, meaning giving it before someone hits that critical low blood pressure. What are your thoughts on that?
Yeah, that's a really hot topic in the field right now.
Yep.
And, the research is still evolving, but some people argue that being more proactive could help prevent people from getting worse.
Mm-hmm.
Well, others are worried about the risks of using them too much, too early. It's something to keep an eye on.
Yeah, definitely. It's fascinating how this field is always changing, always evolving. Now, oxygen, that seems like a no-brainer for sepsis, right?
Right.
But the article seems to suggest that maybe we're overdoing it sometimes. So is there an actual recommended target for oxygen levels?
Yeah, it's true. Oxygen, like you said, it's essential, but too much can actually backfire.
Right.
But the tricky part is there's no, like, magic number for oxygen levels in sepsis patients.
No magic number, huh? Okay, so how are they making decisions then?
Well, the review, it really emphasizes this thing called a low tidal volume approach when ventilators are needed. So basically, instead of those big forceful breaths, they're going for smaller, gentler ones.
So it's about finding that balance again, giving enough oxygen, but not going overboard and like hurting the lungs.
Right. It's all about minimizing that damage.
Now, the article also mentions high-flow nasal cannulas.
Yeah.
Where do those fit in?
So those are a really good example of how treatments are evolving. They deliver this heated, humidified oxygen at a higher flow rate than your typical oxygen mask. So it's kind of like a bridge between a regular mask and a ventilator.
Okay, so a middle ground for patients who need more support but aren't quite at the ventilator stage yet.
Exactly. And they've been showing a lot of promise in sepsis patients who are having trouble breathing, but more research is always being done, of course.
Of course, always more research. Now, speaking of promising treatments, this review it goes beyond just the big guns like antibiotics and fluids. They talk about other things like heparin. Now, I know that's used for blood clots, right?
Right.
But is there more to it than that?
There is. So heparin's definitely key for preventing those clots, which, huge problem in sepsis.
Yeah.
But newer research is saying it might actually have other benefits that are specific to sepsis.
Like what? What kind of benefits?
Well, it seems like heparin might be able to kind of tweak the body's inflammatory response,
Okay.
which we know can get a little crazy with sepsis.
Right, out of control.
Exactly. And on top of that, it might even improve that microcirculation that we were talking about.
Wow, so it's doing double duty there.
It's a busy little drug.
That's pretty amazing. So it's not just about thinning the blood, it's like fine-tuning the body's response to the infection.
Right, exactly.
That's fascinating. The article also mentions insulin, so I'm assuming that's about keeping blood sugar in check, right?
Yeah, absolutely. Sepsis can really mess with the body's blood sugar control.
Mm-hmm.
Often leads to these dangerously high levels.
So you're fighting the infection,
Yeah.
and now you've got this wildly fluctuating blood sugar to deal with on top of it.
Exactly. It's like a double whammy.
Yeah.
And that's why maintaining good blood sugar control is so important. And the review really pushes insulin as the way to do that.
And is that because it acts faster than some of the other medications?
It's the speed and the precision.
Okay.
Insulin lets you make these very fine-tuned adjustments, which is really important when those blood sugar levels can change so quickly.
Got it. Now, another treatment they mention is proton pump inhibitors, or PPIs.
Right.
Now, those are often used for ulcers, right?
Right. So what's the role there in sepsis?
There's one of those things that have become almost automatic, like a just-in-case kind of thing.
Right, right.
But the article suggests that maybe they're not always needed.
Interesting. So are there still times where they might be warranted?
Absolutely. There are definitely situations where they might be necessary, but it's more about making that decision on a case-by-case basis,
Okay.
weighing the pros and cons for each individual patient. It goes back to that individualized approach.
Yeah, it seems like everything keeps coming back to that.
It's really the key.
Yeah. Now, the review also touches on renal replacement therapy, or RRT, which is basically dialysis.
Right.
So if someone develops kidney injury from sepsis, is that automatically the next step, the RRT? Not always. It can be life-saving, don't get me wrong, but it's not a one-size-fits-all.
Right.
The article really emphasizes that the decision to use it should be made based on the individual patient.
Right. So looking at how severe the kidney injury is and, like you said, other factors specific to that person.
Precisely.
Okay. So the review kind of wraps up mentioning a few other treatments. Steroids, sodium bicarbonate, and even something like acetaminophen.
Yeah.
So what's the quick take on those?
Okay, so steroids, they're interesting because their use in sepsis has been, debated for a long time.
Yeah.
They can help to kind of calm down that immune response, but the evidence for using them routinely is kind of mixed.
I see.
However, there's a specific type, hydrocortisone, that might be helpful in cases of septic shock where the blood pressure just won't come up. So potentially another tool in the toolbox, but not a first-line agent in most cases.
Got it.
Now, sodium bicarbonate, that's sometimes used to treat acidosis, which is pretty common in sepsis.
Right, right. And acidosis, that's when the body's pH gets out of whack, right? It becomes too acidic.
Exactly. And it can cause some serious problems if you don't treat it. So sodium bicarbonate basically acts like a buffer, helps to get that balance back to normal.
So again, it sounds like another one of those treatments that needs to be used strategically, not just automatically.
Exactly, you got it. Now, acetaminophen, which most people know as Tylenol,
Right, Tylenol.
it's not really a sepsis treatment in the sense that it's directly fighting the infection.
Okay.
It's more about managing those uncomfortable symptoms.
Right. Make the patient more comfortable, which is, I mean, it's important.
Of course, comfort is a huge part of care, even if it's not, attacking the illness itself.
Right, absolutely. So we've covered a lot of ground here,
We have.
from the antibiotics and fluids to like heparin and sodium bicarb. What'd you say is like the overarching theme of this whole review?
It really seems like everything points to this shift, towards personalized sepsis care. It's not just a one-size-fits-all anymore.
Yeah, which makes sense. I mean, like you said, sepsis, it can look so different from one patient to the next.
Exactly.
So you really have to be on your toes. It's not just about knowing the protocols, but about knowing when you might need to go off script a little, right?
Yeah, you have to be ready to adapt. And that's what makes it so challenging. But it's also, honestly, it's what makes it so rewarding.
Yeah. You really feel like you're using all your skills. This review definitely shows how dynamic the field is, you know?
Right. Always learning.
Like there's always something new to discover with sepsis.
Absolutely. And, even with all the progress we've made, there are still so many questions, so much we don't know. And that's what I love about it. It feels like every question we answer just leads to like a dozen more.
It's like you're peeling back the layers of an onion.
Exactly. Like, what if we could develop treatments that are even more targeted,
Yeah.
based on a person's specific immune response or even the type of infection they have? I mean, that's the future right there. That's where the research is headed, and it's super exciting.
Well, it's great to see, your enthusiasm, your passion for this, even after all these years of, being on the front lines.
Oh, it keeps you going,
Yeah.
It's constant evolution, always something new to learn.
That's for sure. Well, I think this deep dive has given us, and hopefully all of you listening, a much better understanding of, just how complex sepsis really is. And of course, all the latest and greatest when it comes to treatment. Clearly, it's one of those areas where staying curious, asking questions, that's really key.
Couldn't agree more.
So keep diving deep into that knowledge, folks, and we'll see you on the next one.